You know, our bodies are amazing. They have this incredible built-in toolkit to fix themselves. It's a story that plays out right on our skin, practically every day. So today, let's pull back the curtain and really see how that amazing journey of wound healing actually works.
I mean, think about it. From a tiny, annoying paper cut to something way more serious, we've all been there, right? But have you ever stopped to wonder what is actually happening the second you get hurt? What kicks off this super complex, perfectly timed response? Well, that's exactly what we're going to dive into.
All right, so before we can even talk about the repair crew showing up, we got to understand the damage report first. So let's start with the basics. What exactly is a wound?
Okay, so super simple, right? A wound is just any kind of break in our body's protective armor. We're talking about our skin, mucous membranes. It could be a cut, a scrape, a surgical incision, you name it. Anything that messes with our tissues. And that break, that's the alarm bell that kicks the whole system into high gear.
And that alarm bell triggers the response. You know, wound healing isn't magic, even though it sometimes feels like it. It's actually a super organized biological process. I like to think of it as your body's own internal construction company, and its one and only job is to get things back to normal, ASAP.
So how does this whole construction project work? Well, it's not just one big, messy job. It actually unfolds in 4 pretty distinct, but sometimes overlapping phases. Each phase has its own special crew, its own specific job, and its own timeline.
Okay, so here's the blueprint, the project plan. It kicks off immediately with hemostasis. That's all about damage control. Right after that, the inflammatory phase comes in to do the cleanup. Then the heavy lifting, the proliferative phase to rebuild. And finally, the maturation phase to strengthen everything and do the final inspection. So let's break down exactly what each of these crews does. Literally, the second you get hurt, the first responders are on the scene. This is phase 1, hemostasis. Platelets in your blood just swarm the area, clumping together to form a clot. Think of it like an emergency plug, you know? Its job is to stop the bleeding, right now. It's that absolutely crucial first step to contain the crisis.
Okay, plug is in. Next up, the demolition and cleanup crew. This is the inflammatory phase. And by the way, this is exactly why a cut gets all red and swollen and tender. Specialized white blood cells are flooding the area to clear out any nasty bacteria and get rid of all the damaged cell debris. They're basically prepping the construction site so the rebuilding can start.
All right, the site is clean. Now the real rebuilding begins. This is the proliferative phase. The body starts laying down this whole new foundation of tissue. It's actually called granulation tissue. You've definitely seen this stuff before. It's that kind of new, pinkish, bumpy tissue that starts to fill in a healing scrape. At the same time, new blood vessels are being built to bring in tons of oxygen and nutrients, and the wound itself actually starts to get smaller, to physically contract and close up.
And finally, we get to the finishing touches and the final inspection. This is the maturation phase, and get this, it can last for months, sometimes even longer. This is where a protein called collagen, which is basically the scaffolding for all that new tissue, gets totally remodeled and reorganized to make it as strong as possible. The scar tissue matures, it fades a bit, and it gets tougher. And with that, the construction project is officially complete.
But here's the thing. Our bodies are incredibly smart. They know that a clean little surgical cut is a totally different ballgame than, say, a big open wound. So it doesn't just have one game plan. It actually has different strategies, or intentions as they're called, for how to manage the repair job.
So, let's look at the 2 main paths. First, you've got primary intention. Think of a clean surgical cut that gets stitches. The edges are brought right together, nice and neat. This way is super fast, and you end up with a minimal scar. Then you've got the opposite, secondary intention. This is for when there's a big gap, a lot of tissue is lost, and you just can't pull the edges together. In this case, the body has to do a ton more work, filling in that whole gap from the bottom up. As you can imagine, it's a much slower process, and it's going to leave a bigger scar.
And then there's this third, kind of special case scenario called tertiary intention. You can think of it as the delayed path. This is usually for wounds that are dirty or contaminated. A doctor might actually leave the wound open on purpose for a few days. Why? To give them time to really clean it out and make absolutely sure there's no infection brewing before they go in and formally close it up. So yeah, it's delayed, but it's a much safer way to go.
So, that all sounds great, right? A perfect system. But of course, in the real world, things don't always go perfectly. Sometimes the construction project hits a major roadblock, and the body's repair crew just needs some outside help.
And one of the most common ways to help is something called debridement. See, if a bunch of dead or infected gunk builds up in the wound, it can grind the whole healing process to a halt. Debridement is basically bringing in a professional cleanup crew to get rid of all that junk so the project can get back on track.
And there are actually a few different ways to do this. You can have surgical debridement, where a doctor literally cuts away the bad tissue. It's fast and precise. There are mechanical methods, like using special dressings that lift the debris away. You can use the body's own enzymes to do the job. That's called autolytic. Or you can apply chemical enzymes. But then there's one more method, and it's a little different.
Yeah, you're seeing that right. Maggot therapy. Now hold on. In some very specific controlled cases, sterile medical-grade maggots are used for debridement, and they are shockingly good at it. They only eat the dead necrotic tissue and they leave all the healthy tissue completely alone. It's definitely not common, but wow, what a powerful and kind of weird tool to have in the wound care toolbox.
Okay, now we need to talk about the most serious complication you can have, gangrene. This is when things get really bad. It's when body tissue actually dies, either because it's lost its blood supply completely or because a really severe infection has just taken over.
And when an infection takes over like that, the situation becomes a true emergency. And not all gangrene is the same. The specific type you're dealing with determines just how dangerous and, believe me, how fast-moving that emergency is going to be.
So knowing the difference here is absolutely critical. First, you have dry gangrene. This is usually from a loss of blood flow, and the tissue gets dry, black, and shriveled. It tends to spread slowly. Then there's wet gangrene. This one involves a nasty infection. The area is swollen, moist, and it smells really bad. It spreads fast. But the most terrifying one is gas gangrene. This is caused by a specific type of bacteria that produces gas bubbles under the skin. It is immediately life-threatening.
Okay, that all sounds incredibly serious, and it is. But the good news is that modern medicine has this amazing, comprehensive toolkit to manage wounds, to help the body do its job, and to step in when things go wrong.
And it's not just one thing. It's a whole multi-pronged approach. I mean, it starts with the basics. Proper cleaning, sterile dressings, and nutrition is huge. Your body needs the building blocks, protein, vitamins A and C, zinc to do the repairs. Then you have the medical support, like antibiotics to fight infection, and of course, pain management. And yeah, when it's really needed, you have surgical interventions, which can range from that debridement we talked about all the way to amputation in the absolute worst-case scenarios.
But you know, it's also so important to remember that healing isn't just a physical thing. Dealing with a severe or a chronic wound, that's mentally and emotionally draining. That's why things like patient education and psychological support aren't just nice to have. They are an absolutely essential part of a successful recovery.
So when you really step back and look at the whole picture, the body's ability to repair itself is, well, it's nothing short of extraordinary, right? From that first alarm bell of an injury all the way to the final remodeling of a scar, it's this incredibly complex and efficient process. Which kind of leaves us with one big question, doesn't it? Knowing just how hard our bodies are working to protect us, what can we do to better protect them?